Women's Fund of Greater Fort Wayne has conducted extensive research into the challenges that are facing the women and girls in our county. What are some of the most pressing issues that you've uncovered, and how are they going to impact their health or their well-being of all the women and girls in our community who are affected by this?
So I know today we're really talking a lot about sexual violence and specifically when it comes to sexual assault and sexual violence. We know that about 33% of women in our community experience sexual violence in their lifetime. And as we were conducting that study back in 2020 and listening to the agencies who provide a lot of that direct service work, we heard that our local system of care is really difficult for survivors to navigate. For example, there is one place in the surrounding 19 counties to access a forensic rape kit.
Mm.
So those rape kits that Joyful Heart Foundation advocates to be tested, there's one place where you can access getting that rape kit done. And it's an amazing place. It's the Sexual Assault Treatment Center over off Lake, and they do an incredible job. The nurses there are the heroes of the world. But it's really hard to know that that's where you should go if you don't know that's where you should go. So we've really seen some challenges with survivors showing up at the emergency room only to be told they need to go to the sexual assault treatment center. And what happens if they don't have transportation? Well, often they're transported in a police car, which you can imagine that can be incredibly re-traumatizing for a survivor who's just experienced an act of violence to then be taken almost like they're a criminal
Mm.
to get that rape kit. So we've really tried to focus on our local system of care. How can we make it easier for people to know where to go for the type of help they need? For example, the treatment center also has people show up who are looking for therapy and they don't do therapy. So they're sending them to places like the YWCA or Courageous Healing. So we are doing a lot of work to make that system of care easier for survivors to access and easier for agencies to refer clients to one another so that at least when you need help, it's easier for you to get to it.